Hi, my name is Andrea. I'm going to be talking about Sustainable Development Goal, Good Health and Well-Being. Sustainable Development Goal number 3, Good Health and Well-Being, focuses on ensuring health and well-being for all individuals, regardless of age. This goal addresses major health priorities such as reproductive, maternal, and child health, infectious and non-infectious disease, environmental disease, universal health coverage, and access for all to safe, effective, quality, and affordable medicines and vaccines. Infectious diseases, the focus of this presentation, are the world's greatest killers that present one of the most significant health and security challenges facing the global community. Infectious diseases are an overwhelming public health problem in both the developed and developing worlds. Some diseases have been eradicated thanks to successful vaccine campaigns, but others have very little hope for getting under control. According to the U.S. National Institutes for Health, 16 new infectious diseases have emerged in the last 2 decades, and 5 others have been considered re-emerging infectious diseases. A new disease means that these viruses and microorganisms may have existed prior to discovery as non-pathogenic agents, but have recently mutated into pathogenic agents. As shown in Table 6.2, the main target in relation to infectious diseases is Sustainable Development Goal Target 3.3, which refers to ending the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combating hepatitis, waterborne diseases, and other communicable diseases. This table also lists various other important aspects of eliminating infectious disease. Rates of infectious disease are lower than in previous years, but are still substantially high. HIV incidence was highest in the World Health Organization African region at 2.6 per 1,000 uninfected population in 2014, as compared with other regions where incidence ranged from 0.1 to 0.4 per 1,000 uninfected. In 2014, 2 million people were infected with HIV, 9.6 million with tuberculosis, and 214 million with malaria. 56.1 million deaths occurred in 2001 with infectious disease, causing 1/4 of them. 45% of these deaths occurred in developing countries. The problem of infectious disease extends into the biological, social, and political world. The consequences of infectious disease are devastating for the people and the economies affected. However, they do not receive a significant amount of attention or funding because the real costs are not understood in a concrete way. Costs of infectious diseases can be measured in a variety of ways, such as the effect of disease on health and quality of life, dollars spent on healthcare, and lost productivity. There is an indirect but clear relationship between infectious disease and political instability. For example, a 2003 study focused on the causes of instability and found that tuberculosis prevalence strongly correlated with political instability, even in democratic nations. When infectious diseases impact countries socially and economically, the disease is likely to tantalize a struggle for power to control valuable resources. Because of this, nations should place health at a high priority. Since infectious diseases result in widespread illness and death, particularly among young, healthy, and working people, this valuable resource can take a toll in undeveloped and developing nations because they are usually unable to handle the immediate costs of an outbreak. These countries often cannot handle the long-term costs of endemic disease as well. The true economic burden of most infectious diseases is not known, as there are no estimates of the political costs and very few estimates of costs to the countries. In 2010, it was estimated that $15 billion were spent globally on dengue fever. 769,122 DALYs, basically lost years of life, health, and productivity, were estimated for dengue fever in 2010. The global cost of cholera in 2010 was $5.3 billion, and the world also lost nearly 2.6 million years of health, life, and productivity. Since 2000, 36.1 million people were living with AIDS. According to the World Health Organization, the economic burden of AIDS on sub-Saharan Africa is approximately 72 million DALYs. Assuming that each DALY is valued at the per capita income, AIDS represents 11.7% of the gross national product. Because people are unable to access or afford antiretroviral drugs in developing countries, the viral load increases as years go by without treatment, as shown in the graphic. The lack of testing, as well as bias against infected individuals, also contributes to the lack of treatment and therefore the increase in viral load. Infectious diseases that begin in underdeveloped and developing nations are easily able to spread to richer nations. This can have severe consequences for trade and commerce in all parts of the world. Many people are affected by infectious disease across the globe. However, children seem to be the most affected by this problem. Although the childhood death rate from infectious disease has decreased in recent decades, preventable infections caused close to 2/3 of all deaths in children below age 5 in 2010. Of all infectious disorders, results show that pneumonia, diarrhea, and malaria were the leading causes of death worldwide. Of all deaths in children aged younger than 5 years, pneumonia accounted for 18.3%, or almost 1.4 million deaths. Preterm birth complications, intrapartum-related complications, and sepsis or meningitis were the leading causes of neonatal death. Pneumonia, diarrhea, and malaria were the leading causes of death in older children. Most of the deaths were reported in Africa, about 3.6 million, according to researchers, followed by Southeast Asia, where 2.1 million children died. Every year, there are between 400 and 900 malaria infections, and over 75% of these infections are in African children. Only 20% of these infected children ever see a doctor for treatment. Children endure cognitive damage, and families spend approximately 25% of their income on treatment, if they receive it. The solution to the widespread issue of infectious disease seems simple, doesn't it? Get rid of the disease vector, immunize the world's population, and protect the most vulnerable. This was done to halt smallpox in its tracks, and essentially abolished it from nature. Why can't it be done for diseases such as cholera, malaria, and HIV/AIDS? Knowing when and where diseases will strike is not easily understood, nor is it known when and where new infectious diseases will emerge. HIV and the flu, for example, are constantly changing their genetic makeup, making it near impossible to form human resistance against. This cannot be blamed solely on biology, however, as these diseases continue to plague the most vulnerable populations due to social and political causes as well. Hope is not entirely out of sight, though. Infectious diseases can be controlled in relatively inexpensive ways. Hand washing has been shown to reduce the amount of bacteria on hands by at least 50%. Cleaning and disinfecting surfaces and handling food safely are also effective ways to keep some infectious diseases at bay. Immunization, though controversial, has been shown to save millions of lives and keep populations healthy and disease-free through herd immunity. Changing the way we use antibiotics in healthcare is an important solution to controlling infectious disease, since the misuse and overuse of antibiotics has resulted in extreme resistance of many harmful agents. I'm personally always an advocate for education. The greater number of people who have the correct information regarding infectious disease management, the better. This is especially true for teaching safe sexual habits, which can greatly reduce the number of new cases of HIV/AIDS and other sexually transmitted infections. We live in a country where medicine is safe and accessible, and research is supported to bring about some of the most innovative ways to fight illness. No child is at high risk from dying from dehydration due to cholera because they cannot travel or afford to see a doctor. Healthcare is not perfect in the United States, of course, but the risk of dying from some of the most communicable diseases is very low compared to countries in the developing world. Biological, social, and political issues around the world are preventing millions of individuals from getting the resources and education they need to keep themselves and their families from getting sick. Antibiotic resistance and genetic mutations, combined with political and social instability, makes it seem nearly impossible to stop the rates of infection and ultimately eradicate the diseases. There are solutions, such as promoting cleanliness, immunizations, and educating people regarding safe sex. However, these solutions need to be taken seriously by the political world, as infectious diseases are indirectly but clearly related to the economy and quality of life in many developing countries. Some excellent resources for information regarding infectious diseases are the World Health Organization, the Centers for Disease Control and Prevention, and the National Foundation for Infectious Disease. To learn more about the fight against HIV/AIDS, visit the UNAIDS website.